I want to thank everyone for participating here today. And certainly, especially want to thank our panelists, who I know bring a great deal of insight and expertise to our gathering here today. Of course, I wish we could do this in person. Doesn't seem to be the option right now. And looking at the snow outside, it might be a little safer to engage this way as well, at least on this day. But I want to first introduce Leslie Marsh. Leslie is the CEO of Lexington Regional Health Center, right there in central Nebraska, Lexington, Nebraska. Leslie, although she heads the hospital, and she's done that for about 10 years, I believe, Leslie has been a nurse, master's in nursing as well. Also joining is the CEO of the York General Hospital, Jim Ulrich. Jim is a 28-year veteran of healthcare and has been leading the hospital there in York since 2016. Then also we have Michelle Wineinger. Michelle is a rural health coordinator with CMS, and she's a subject matter specialist in insurance. And so again, grateful to have all of you on the panel here today. Before the pandemic, our economy, as you know, was at a record high, and businesses, small and large, were prospering. And obviously now, due to these unforeseen circumstances, our communities are faced with significant obstacles. I think Congress stepped in with the Paycheck Protection Program that has been very effective. We know that it's really filled in some areas that we know needed some attention. I think it was very efficiently laid out as well. Now moving forward, we don't know what the next COVID relief plan looks like. Obviously, even though I thought maybe the election last week would give us more definite direction moving forward. I guess we should never put too much faith in one election, right? But the outcome, obviously, nationally was much closer than anticipated. I think in speaking as a House member, Speaker Pelosi was predicting that she would run the table on picking up House seats. That did not happen. In fact, quite the opposite. And so the COVID message that she was really engaged and all in on has fallen flat. Now, there's some good parts to that. I am biased, I will admit, but we need to get things in order here so that we can do what we are responsible for doing, and that is hopefully bringing some stability to healthcare and communities. With the rise in cases, I know that folks are shifting gears yet again here, at least in our community in Western Nebraska. So Leslie, you want to kick it off and share with us your perspective, and then we'll go down the line on panelists and then throw it open to Q&A after that. So Leslie, go ahead.
Sure. Well, thank you so much for allowing me to participate on this panel. It's a pleasure, and as always, and yes, you're right. I think we need to get a handle on things that are going on. I also want to thank you for your work on the PPP. I know we had some meetings with you early on, and yes, it's very helpful and really did sort of carry the day, I guess, during that first surge that we had leading up into the surge when we were all sort of just hunkered down. But we are seeing an increase in cases again, and so of course with people having community exposure, there's just we're not staffed for that, and I think we're seeing that across the state. And so, but we pulled together in Nebraska, right? And we're team based here, and so that's what we're doing in our communities. I do think it's an important. You have to strike a balance, and so shutting everything down is not necessarily the way to go. I think you've got to look at what are you experiencing in your community, and right now, of course, hospitalizations and hospitalized beds that are staffed are a problem, but I think that's really a nice way to be able to say, well, hey, how much do we have to really close shop down and just, in the meantime, practice the things that we know work, because they work for influenza, they work for COVID. The masking, social distancing, all those infection control practices. So we've been trying to get that message out to the community, and we have a diverse community in Lexington. And so it's been really important for us to leverage our community health workers who do have trust in the community. And they do speak, we're predominantly Latino in Lexington, a majority Latino, and then we have about 15% Somali refugees also as a result of the meatpacking plant there. So we were able to work together with them as a community. We worked with the school, we work with the city, we work with businesses, area business leaders, and the medical communities to make sure that we're doing all that we can to help keep people safe. And I'd like to, give a shout out actually to the meatpacking plant for immediately, as soon as they realized, getting some processes in place, and we were able to stop that spread that's just related to working in environments where you're close to other folks. So all great community partners, and there is food insecurity and poverty and all of those things that are occurring at a greater level now, I think, with COVID. And so we're all just pulling together, and there's delivering meals and doing those things that we do. But I think, that we're not used to sustained sorts of disaster preparedness, you might say. So this has been a little bit different and a little bit, I think, harder on people, which is why I think that fatigue has set in and has created a little bit of community spread that we didn't see previously. So I think it's when you think about hospitals and some of the things that I think are really important to share, if we wouldn't have had a strong hospital with really great, highly skilled providers and nurses and all the people that help to make a hospital successful in terms of being able to care for patients, I don't know what we would have done, because we had, back in April through the first week of May, we were full. We had 2 COVID wings, propped up, and we are have a busy ER anyway with really fairly critically ill patients, just because we're, just because of our diversity, we're right off Interstate 80. And so it's really important to be able to be there for the people that you serve. We're a young community, and so patients aren't going to travel to another business or hospital. They're not going to go down the road 40 miles when they might just show up in your ER, and be ready to have a baby. And you better be prepared as best you can in terms of training and to take care of those patients. And so I think that's really important for policymakers to understand that, Nebraska and the Midwest is not the same as Maryland, for example, where maybe a critical access hospital is not very far from, a larger facility. And maybe it is just it is possible to travel, and there's maybe more public transportation, but that's not that's not what we see. So I think it's really just important, and I think that's been really accentuated in terms of patients that have needed us through COVID. We've delivered. We've had moms come in that are COVID positive. We're doing testing. We're working with the state to do test Nebraska, as well as doing our own rapid test, and there was help with that as well. And through the funds that were released early on in the first package, we were able to secure funding for high oxygen delivery devices, and that really works when you're pretty sick and you put a patient prone and you put them on some high oxygen, and you can do a lot better than when you don't have that. So appreciate that as well, and certainly our community does. But I think it does illustrate the importance of being able to continue to deliver that high quality care, to be there when we're needed, and not just for managing healthcare, but also there are times like this and emergencies and babies and illnesses that require hospitalization. And so I think that it's really important that we don't lose sight of that. And I always think of us as one leg on a three-legged stool. And if you get rid of that leg, it's a pretty wobbly rural community then, whether that's a school or the city or whatever it is. But we really end up bringing in, if we left, I often say, we've recruited, 4 doctors. And so that's really been nice for us, as well as having, 10 non-physician providers. So it's really been a nice mix. And those people would also leave if the hospital weren't there, because they're employed by the hospital. People want to be employed now often by hospitals. And so I think we're set up to move forward in a really nice fashion. But we just have to weather through this, and we have to keep our rural economy strong and support our local businesses. And so we've really been able to do a lot of nice things. And I think we've been able to help in all kinds of ways that you might not think that hospitals do help. We picked up the public health. There was, a gap in public health. So we help with contact tracing. We had a virtual, we leveraged technology. So we have hospitalist program, and that uses technology. And we have a intensivist through technology using telehealth. And really you had to use this a lot for behavioral health, and you'd be surprised, they kind of liked it for behavioral health. The patients really enjoyed that. So when you're thinking about health overall, those are things that we do to help maintain our community in the best way possible, and so that they're able to be best suited to help prop up our economy, and also to interact with one another the way we do in rural, and probably everywhere, but certainly in rural, and assist each other, and just to have the best possible life, high quality life, in terms of wellness and in terms of prosperity. So that's my 2 cents, I guess, my lead in terms of what do I think we contribute. Way more than that, but I also think that we're struggling. As you know, 40% of critical access hospitals are experiencing negative operating margins, and 340B, all of the things that we've talked about before, we really still are interested in moving the needle on. So, and we know we can look to you, Congressman Smith, and we know that you're going to listen to us. And so I think that's in our community, certainly almost universally felt. So thank you for your leadership and your service.
Well, thank you. I appreciate that. I consider it a privilege to work with critical access hospitals and all of you guys. It really, especially during the pandemic, I think that you all have risen to the occasion in a way that, not that you needed to prove yourselves before that with me, but certainly salute you and all of your staff for truly being heroes among us. So, Jim, you want to give us your perspective? Thanks, Matt. Leslie.
You bet. Thank you.
Sure. Congressman Smith, thank you. And Leslie, thank you for your comments. I kind of want to make sure I don't repeat too much. So I'll add on some different things as well. Congressman Smith, we've known each other, seems like forever. It was in about 16 years and worked with you out there quite a long time too. And I can tell you, over the 33 years that I've been in healthcare, there's been nothing, and I'm sure everybody on the call can say the same thing. There's been nothing like this that we've seen over that period of time. But so I wanted to echo the thanks for the opportunity, first off, and also for all your support over the years, Congressman Smith, and in particular during this time, for your help in all the relief funding that we've received, as Leslie has mentioned, and we put it to some great use as well. And I'll try to touch on at least one or two of those as well as we go. I wanted to just paint a picture, because I want to bring in a little more than even the critical access hospital side, because York General Healthcare Services just short of 500 employees, and we have a critical access hospital and has 50 plus visiting specialists. So that just paints a little bit of the picture of the services that we do provide along the way. and local access to care, which is so pivotal. Our Westview Medical Campus has home health and dialysis, a 12-chair unit. We provide daycare for our staff, a shot clinic for immunizations. And now we have drive-through outpatient testing in Test, Nebraska, which is very busy there as well. So another outlet, another campus for access to care that if we didn't have the home health available in York, or if we didn't have dialysis, there's a lot of travel that's involved for the individuals in our region for their services. We have a 127-bed skilled nursing facility too in York General Harstow. So that's presented a whole different gamut of challenges too, as you have residents that can barely see their loved ones over this period of time that's gone back to March, really. And just the challenges of staffing and the morale of employees and you know, the lifestyle that residents were accustomed to that they just don't have today, all those different challenges. Willowbrook is a 40-room assisted living as well. So that echoes the same sort of thing as a skilled nursing facility. And then we're starting some new access that is starting to take shape out near the interstate and building a clinic that'll have reference lab services through Quest Labs, and then a joint venture clinic with York Medical Clinic here as well. So all those things are put out to be great access to care for our region, really, in rural America. And so we do promote this availability of services that we have by radio, paper, social media, way more than it used to be. I'm getting a lot of traction there. Presentations, social clubs, most of those are Zoom now, it seems like, and radio shows, and then being as involved as we can in the community and in the region. So we have also wellness and live well committees that are getting more and more active on lunch and learns and dietitians for the health of our citizens of our community. So we're trying to reach out more and more, and having those fingers out in the community gives us more of an ear to the community overall. We want to be that trusted resource for healthcare information, and we're really striving hard to do that. And so communication during this pandemic has been so critical, and working with our Four Corners Health Department, as well as our York County Development Corporation and our Chamber of Commerce for our community sector briefings that we do weekly, and then unified command meetings with Four Corners Health Department all the time too, and just getting that voice out and those educating the public as best we can. We're trying hard, just like Leslie mentions, to do with the surge of cases, even more and more about promoting and sharing some of the American Hospital Association messages on masking and social distancing, and trying to do our own campaigns as well through social media. And it's hard to be out in the public right now, so you got to use those medias that are available to you. So on COVID-19 though, like I mentioned, tons of staff and community communication. We're taking, like most facilities, a pretty open book on how we talk about this. You know, where's the hospitalization rates? How many COVID patients are we seeing? How much testing are we doing in our community? We're breaking records daily for the number of testing we're doing on an average week. Let's see, last week we saw 152 individuals through our Test Nebraska site. And then on top of that, we're doing about 130 our drive-through testing. So there's a lot of testing that's going on, and amongst also testing our Hearthstone staff. That's about 130 of our 480 staff members. Twice a week we're testing, according to CMS regulations, and then also we're testing our residents as well weekly. To date, we've kept out almost all the COVID out of our nursing home. We've got a couple positive cases today, but we're able to, the way our neighborhoods are set up in our nursing home, to isolate those individuals, and we've been successful so far. Because you've seen what can happen in communities when COVID-19 runs through a nursing home. It's not pretty. And so we've been very vigilant in our efforts to keep everybody safe in that regard. One of the stories that I wanted to mention just on local access to care, Congressman Smith, was there's recent regulations in the last few years for pharmacy that kind of required much more big changes to everybody's pharmacy in the way of how IV medications and other medications are mixed, and like negative pressure, positive pressure, hoods, and things like this. So multiple hundreds of thousands of dollars for investment to comply with those regulations. And we invested in that in our region so that we could keep a very important access to care, and that is chemotherapy in our area. And we, at the time, presently in our surrounding counties, were the provider that can do that. And it doesn't mean that some of our surrounding communities won't do it, but they're not there yet. And so we have seen more and more, unfortunately, chemotherapy patients that can have their chemotherapy at home today than we ever have. And so that, along trying to do that in a COVID-19 environment with all the restrictions and all of the, upon entry to our facility, taking your temperature, taking questionnaires, all those things, wearing masks, we've strived really hard to navigate that world. And now I will tell you through the, we do have a COVID-19 wing, as Leslie mentioned. You go back a couple months ago, we probably wouldn't have thought we'd have to keep COVID patients in our rural facilities, but we have the ability to shut down one of our wings and make it completely negative pressure, so an isolation COVID wing. And just last couple of days last week, we got up to 6 patients in our COVID unit, and giving them remdesivir, convalescent plasma if needed, just the dexamethasone, so some of those medications, and they've responded real well. But we're watching and planning for the day that if Bryan Health cannot take those patients, or if St. E's in Lincoln, or St. Francis in Grand Island, or those surrounding facilities, because 794 patients in Nebraska today that are in hospitals. And a couple weeks ago, honestly, that was in the 400s. And so we've really had a big uptick in hospitalization. So Leslie and I both feel wholeheartedly that critical access hospitals will continue to take a bigger role in what's going on in COVID-19. And one of the, in a weird, strange way, a blessing that we had is, in York anyway, is that we did not have the initial surge maybe that Leslie had. Now that could be a blessing to her too, because she's better prepared for it as well. But we had everything in the surge planning that now we're putting into place. So we had all that done. I know how to shut down departments if we need to. We don't want to, just like Leslie mentioned, we think we're better at managing those things today and doing it in a safe way because of our experience through this pandemic. And we're here to meet the needs. When I give those communications to our public on what's going on recently, I always end with the fact, I know what I'm telling you is, not necessarily the best news, but we are here and we are treating folks, and we can continue to do that. Staffing challenges are great. The CARES Act funds and the PPP funds have been very beneficial in that regard. So thank you again. We did use some of the CARES Act funds to purchase some UV light robots to disinfect both rooms and departments, as well as some of our PPE. And that has been a very good investment on our part. We use it on surgical suites and OB suites because we've had to do surgery on COVID patients and deliver babies, as Leslie mentioned as well, to COVID positive patients. So there's things that you really are proud of your team through all this, because it's like, I had faith that everybody could do this, and boy, they proved that's come true. And so to be that trusted resource in our communities, we're doing that, and we'll continue to do that. And again, Congressman Smith, I'll echo Leslie, you've always been there for the facilities that I've been with and all those in Nebraska, both in McCook for those years, as well as here in York. It's someone who we can call upon very quickly and get an ear very quickly on those items. So I know we go back and we've talked for years on 96-hour rule, physician supervision, those kind of things, 340B, as Leslie mentioned. So appreciate, and it's always very, very nice to know that we have a definite in our corner in DC. So thank you. I'll conclude my opening comments for that too.
Well, thank you, Jim, for your perspective there. And it is interesting how you point out that the numbers are different for you now than they were last spring. That were a little bit different for Leslie there in Lexington. So I'm glad we have got diverse perspectives here as well. Michelle, would you like to share with us your perspective from the federal level and what you have to offer us? Go ahead.
Sure. Thank you, first of all, for the invitation and the opportunity to participate today. I just really briefly want to, first of all, say thank you to Jim and Leslie and to all the critical access hospitals and all the healthcare providers out there. We as an agency very much appreciate what you're doing on the front line, and hopefully some of the things that we've put into place or implemented are making your jobs a little bit easier. But we do recognize what a great job you all are doing. I want to, first of all, just kind of start off from a general level, just to make sure that everyone is aware that we did announce a new listserv that you can sign up for that's specifically targeted for the rural population. So for providers, patients, anybody who's looking for information from CMS, from a rural specific standpoint, you can sign up for a listserv on our site, on the cms.gov site. If you have questions about rural health, we have a team that actually can answer those questions, and there's a general email box that you can answer those questions, or you want to raise an issue to us and make us aware of it. It's ruralhealth@cms.hhs.gov. That's a great resource email for you to look into. I want to talk a little bit about what CMS has done during the PHE, which most of you are aware of, and from the CARES Act, from the provider relief funds that came out. Our job was to implement that and to get that policy in place. And we did that through interim final rules. We've done that by waivers and flexibilities, specifically, giving the hospitals the ability to have remote sites and to do those temporary sites in the hospitals without walls. And we tried to remove some of those regulatory burdens and do some flexibilities to make it easier for hospitals to be able to respond. We increased telehealth flexibilities. We waived that 96-hour rule that we were talking about. We waived the 25 bed limit for the critical access hospitals for the purpose of the public health emergency. There's just a lot of things that we've been doing along the way. We also, at the very beginning, gave critical access hospitals and providers the opportunity to ask for advanced payments or accelerated advanced payments so that they could have some cash inflow coming in. And then we just recently made some modifications to those repayment terms to make it easier for the providers so they didn't have this huge repayment debt, this repayment to CMS when the cash flow is still not where it used to be for them. Most recently, we just released on the 28th of October, the interim final rule our fourth one that we've put out during the public health emergency, which really is starting to address how we're going to reimburse and how providers can bill for the COVID-19 vaccination. That was just released, still open for comments. So I encourage anyone on here, if you haven't read through it or looked at it, from a community standpoint, to take a look at that and please give us comment on it. That's the purpose of it, is for you to make comment on it, to make sure that we're doing the things that are going to be effective for you, or that you're getting the information and guidance that you need. Regarding what we're going to do, we're already looking beyond the public health emergency, looking at some of the successful things that are being done. We're looking at some of those waivers and flexibilities to see what we can continue beyond the public health emergency, some of those telehealth flexibilities, and are there things that we just need that are working really well right now that can go on beyond the public health emergency. Some of the things are statutorily excluded, and that's where Congressman Smith, you and your colleagues come into play on making sure that if those are successful, that those need to be changed through Congress. That's something that CMS cannot change. So If you in the community or as a provider are seeing things that work that are statutorily excluded beyond the PHE, you need to work with Congress to get those things changed. But we are definitely looking at that. There's a lot of flexibilities out there. There's a lot of resources out there. And I'm a rural health coordinator in our CMS Kansas City office, but I have 9 other colleagues. So we're here to help the rural health community. So if you're looking for resources from CMS, or you're looking for guidance from CMS, and you're struggling to find that information, I'm email away, I'm a phone call away. So I encourage the providers in the community as a whole, if you have questions regarding Medicare or CMS or things like that, please don't hesitate to reach out to me. My contact information is on Google. If you Google the Rural Health Coordinator for Kansas City, you'll find me. But I also want to say, Jim, I've had the opportunity, and Leslie, I'm just now kind of forming a relationship with Leslie and hoping to go forward with that. But one of the things that I've been blessed to be able to do in my position is actually go out and visit the rural communities and be able to sit down with the critical access hospitals in those communities and say, okay, what can we do for you? Or what do we need to know about? And I very much appreciate the opportunity to get out into those rural communities and actually see what it's like, because I am the liaison into the agency. And like Leslie very eloquently said, rural Nebraska is not rural Maryland, is not rural Texas, is not rural California. So what I do is I can take what's happening here in the Midwest, because I'm Kansas, Missouri, Iowa, and Nebraska, and take that information and feed it back to our leadership within CMS when we're writing policy, when we're writing rules, and let them know what's happening here on the ground. So that's what I'm able to do in my position. The other thing I'd like to say that right now our agency is focused on is the flu shot. And we're really pushing the flu immunization because we want to avoid additional impact into the healthcare community, into the hospitals with an increased flu cases. So if we can get people vaccinated for the flu, we're going to hopefully reduce that burden onto the hospitals and the healthcare community as a whole. Going forward. So we really are focused this year on pushing that flu immunization message. And we have a lot of great resources available on our site as well regarding that. And with that, I'll kind of close it up, and that way we have plenty of time for questions or anything else. Thank you again.
Well, thank you, Michelle, for your service and certainly your desire to reflect the needs of rural America. We know that, like every single critical access hospital is a little bit different, even with a single designation, they reflect the needs of the community, for which I'm grateful. And I think it's a great testament, though, to how communities can come together to, as a famous Nebraskan would say, get her done. We'll throw it open to questions here. I do want to introduce, many of you already know Jared Reimers from my Grand Island office, and then Joel Corrales, who handles healthcare and various other issues out of my Washington office. And so they're here to help facilitate and listen to your concerns here today as well. While our participants are perhaps thinking of questions, I want to pose a question perhaps to Jim and Leslie. As you've seen, there's been an evolution of what is advised. I mean, we've seen an evolution in mask usage and in that advice and that insight. We now think differently than we did last spring on mask wearing. And I don't want to look backward necessarily. I'd be curious, though, as we look at our communities across the 3rd District and beyond, what have you as healthcare providers, you've been right at the core of every, with every community, you've been at the core of biosecurity measures and the needs and, scaling that up. What kind of advice could you give anywhere from a coffee shop owner of how they can safely serve their customers to perhaps a larger employer that may or may not have customers coming and going, but definitely have employees coming and going. What kind of insight could you offer there for our communities and the business community as a whole?
I suppose I can take a stab at that, Leslie, unless you're ready.
I'll let you go and then I can chime in as needed.
Congressman Smith, I think you hit the nail on the head. This has been an evolution. And it's something that without a doubt has been a challenge for us, because anytime there's a little ambiguity in the way what is recommended, it ups that challenge, and it also raises that level in the community of what's really the right message. And, what am I supposed to believe? So when I've talked with business owners or even with our health department, is that how do we get out that message of that we are learning as we go, and that includes the CDC as well, where that information comes from. So when I'm talking about different changes and people will say, well, how come masks weren't important before? Hey, we're learning. We're looking at when we started, it was this spreads on countertops or surfaces versus being airborne, right? And then you mix in the fact that sometime in the middle, when things slowed down a little bit, it became a lot of asymptomatic positive people. And now we're back to many more people that are symptomatic and community spread. So the message we try to send is be vigilant and do your part and be smart, really. And to try to just avoid those situations of close contact and big groups, and the social distancing aspect of it as well. And mask wearing, you got to set the example at the store and at the place that you're at. And because if you see a lot of people, if you're trying to be mandatory, or for lack of a better word, you put the sign on there that say mask wearing encouraged, or some of them do say you need a mask to enter, but when half the people don't, or your staff members don't, how is that? That's not going to work. And so trying to remain vigilant and just do your part. And if people say, well, I've got this study that says masking doesn't work, or so on and so forth, I said, do you seriously think without a mask that it's going to be, you tell me that's not helping at all? On that end is what I tried to do a little logic with them. And, but it's no mistaking that the big gatherings, and then from there, community spreads is where it's hit our region. And so trying to say that, listen to your four corners health department, listening to us that are working together with them on the latest and greatest message, because we are learning more about this as we go. There's no mistaking the fact has changed. I'm not going to go try to say someone messed up or whatever. We're just learning as we go. And so do your part and help stop the spread so that we don't run into situations where we run out of hospital beds. And because when the vaccines come out, there's going to be a challenge too on trusting of vaccines and getting the first wave that goes through healthcare frontline workers. You need that so that we can care for those patients come in, but we can also be very good advocates for trust in that message too. Once we receive that and we've got the antibodies and it's working for us, it helps us to promote that message of trust, because we should be that trusted source going forward, and that should help our communities.
Yeah.
Just to echo what Jim said about community and the way that they can help. Like right now, I just pulled up some stats from Lexington's only seeing a 7-day rolling average of positive case rates as of November 6th of 8.2, but the surrounding communities that did not have that surge in the early spring, or one of them's 85.6% positive. So, and a lot of those patients are, as Jim said, asymptomatic or not as sick. So they're thinking they have allergies or something like that, and they're feeling a lot safer because time has gone on. And so it is really important that we reinforce, hey, don't have these large gatherings, because I know that that's where a lot of the, at least in our area, that's where a lot of this spread really began. And the huge impact beyond hospital beds, and we're accepting patients sort of the reverse way. So we, North Platte and Kearney helped us a lot when we were going through our surge, and now we're accepting their patients because, that's just, they're really overwhelmed. So I think it's a matter of being aware of that and of using that community trust that Jim mentioned, to be talking about, for example, we had somebody come in and was having a heart attack, and there was nobody, we had to ship that person. Kearney couldn't take the person, they were full. So we had to get that person to Brian. So we want to be able to always deliver high quality care. And we do talk about the fact that we're safe. We did not, have any transmission of infection in our hospital during that really heavy time. And so we do know that if you do some, practice those sorts of techniques, that it does make a difference. So, and as we all know, as new information becomes available, we adjust and adapt to that. And so that's the way of certainly of healthcare for forever. We don't practice like we used to practice, 30 years ago. So, as new evidence becomes available, then we adapt and change our messaging. So I think it's really important that you're out there, that you're talking about it. We're in Tyson. We have a clinic in Tyson. And so, and they're actually doing a lot of random testing. And so we're identifying people earlier on so that we can get them quarantined and hopefully help to prevent some of the spread that way. But it really is very important for businesses to stay open and for their team to stay healthy by just like hand washing. Not touching your face and that's just the way. It's the same way that any airborne or really it's contact with maybe some airborne components. That's the way that this disease is spread. And so being mindful of that. And to Michelle's comments about getting the influenza vaccine, we've tried to make that readily available. The interesting thing is that people say, well, we're wearing masks anyway, so we don't really need it as much. And it was like, well, actually, yes, you do need it. So we're really trying to make sure that that's available in the school system and available working with the public health department, available in any way, shape, or form, so that people can stay healthy and business can continue, and the people that visit those businesses can be safe as well. And so we're sharing that message, and we have really appreciated. I was remiss in not saying this about CMS's waivers. If we had not had those waivers, I don't know what we would have done, because we had over 3 weeks, we had 42 patients that required admission to the hospital, and but we had a lot more of those that were needing to be triaged or seen and have an MSE, and that ability to do that right outside our ER, because the ER is still a bottleneck area for us. We weren't really set up for this, for care of patients like this. So it does, it can create a bottleneck. And so we appreciated that. And that we have broadband issues in this area. And so being able to use, and plus our community, it's hard to get them to download an app. It's hard for me to talk to my mom about downloading an app. So they're just not used to that. So that ability to use FaceTime, to be innovative, that's really what it takes, is being adaptive and innovative and trusting and working with your community. And so that's, for my 2 cents, that's really where it's at.
Right, Michelle, would you want to add anything to that? And I might throw in another question here while I have you, and that anecdotally, I'm told that flu vaccine is on the rise, I guess. More folks, a greater percentage, are accepting the flu vaccine. Is that accurate, number one? And perhaps can that be leveraged as we move forward once a COVID vaccine becomes available?
Well, to your question, I don't have the data of how many immunizations, like the increased rate of vaccinations. I haven't seen any claims data or anything like that come through from the Medicare standpoint. So I haven't seen any of that yet, so I can't answer that. I do know that there's been an increased interest in getting our resources and an increased interest in passing the messaging along. So I'm going to take that as a good news that people are receptive to and willing to partner with us and want to work with us to help educate their communities. So I'll take that as a plus. Um, um, Going forward, I hope that this helps. I hope that this helps the leveraging for the COVID-19 vaccine. I hope that since we can partner that message or we can marry that message, how important that is. You know, to Leslie's comment, I had not heard that, and I could see where that would be a natural reaction. I'm already wearing a mask. Why do I need a flu vaccine? So I can see, I have not heard that one yet, but that's definitely something I want to make sure that I send up to our leadership, because when we're developing our messaging, maybe that's something we need to address in our messaging as well and kind of be proactive in that messaging. As far as the, I do want to say that I'm very pleased with the telehealth. Thank you, Leslie, for commenting on that. We've been hearing that on the broadband issues, and so glad that we can increase that that flexibility. And it's something that we're definitely hearing that people would like to have continued beyond the PHE. So definitely keep sending those comments forward. And forgive me, Congressman Smith, the first comment that you asked me on, I forgot it because I was thinking about the flu, which you were when you were asking me that. But
well, just kind of applying best practices in businesses, you know, whether they meet the public, you know, with customers or definitely their employees. I know that there's a great concern among very thoughtful individuals that they could do everything that they think is right and still be held liable. There's that fear, at least. I don't think we've seen the rash of lawsuits just yet. But that's a concern on the minds of many. And just, you know, perhaps what you've seen that you could pass along as good advice.
Honestly, from a legal standpoint, I really don't have any guidance or any feedback I can provide on that. You know, all we're doing is just trying to increase the flexibilities again for the healthcare community to make sure that they have the ability to treat that. And then the other thing that we're working on too is from a financial standpoint and from a not only from the healthcare community, but also for the patient who's trying to get these vaccines or trying to get this treatment. And part of this was through the CARES Act, but some of it now is again how we're proceeding with the vaccine is making those vaccines and making that treatment available to everyone regardless of their ability to pay. So we don't want anybody not getting the vaccine because they can't pay. You know, in this IFC4, the vaccines and the treatments in the therapeutic treatments are available should be available at no cost. And not only are we issuing that guidance for Medicare patients or Medicaid patients, but we're also issuing that guidance for private insurers. So we want the private insurers, regardless of whether a patient is inpatient or outpatient or in network or out of network, they should still be able to get these vaccinations and these treatments at no cost. We don't want people not getting treated for this. So I don't want anybody to think that they can't receive treatment because of their financial status. We just don't want that. So we're encouraging everyone, get tested, get treated.
Right. Very good. Anyone else want to ask a question? Certainly feel free. As we are sorting out, you know, what is next in the House, at least, you know, I really ask for all of your input, whether you're directly in the healthcare community itself or certainly other businesses. I think it's vital to get your perspective. I work with my staff team to very diligently hear from constituents to get your insight moving forward, but to please know that there's always more to be heard, I'm sure. So please feel free to speak up, if not today, certainly in the future, as we are assembling the next step. I have a feeling that the next step will be a bit different than what was dangled out there over the last few months. That the HEROES Act, it was just chock full of politics, and quite honestly, those politics didn't end up getting much leverage. And so I'm grateful for that, because we owe the American people, I think, a much higher level discussion and deliberation on the issues that are important and the issues that matter, rather than just looking for political leverage around every corner. Back last spring, when there was more unity against COVID, I think it was a testament to what we can get done in Congress. That's not to say that we just duplicate exactly what took place there in terms of policy. Just like in healthcare, we learn on the science, we learn on the economics and moving forward too, of what's good, what's bad. I grow even more concerned all the time about our supply chains. And in addition to supply chains for PPE, whether I talk to a car dealer who can't get the inventory that they need, or an appliance store that can't get the inventory that is under high demand. In between my many Zoom calls throughout the summer, I worked in the yard and finding some of those materials at the lumber yard, there became a shortage there too. And when there are shortages, that's lost economic opportunity. And so we want to stay on top of that. I think that we will see opportunities moving forward. I just want to make sure the federal government doesn't get in the way in terms of opportunities. I think we will likely see a realignment in the workforce, as we are bound to see some manufacturing jobs come back to the U.S. Let's face it, the fact that PPE manufacturing left our shores some time ago, and it didn't happen overnight, but the fact that China was making virtually all our PPE, China wouldn't even have to act maliciously for that to be a problem during a worldwide pandemic. And so we need to respond accordingly and appropriately with that. And I think we're starting to see that already. And we'll, on the Ways and Means Committee, we handle tax and trade policy. We'll take a look at that. I hope that we can, again, not get in the way, but also be effective about that, and knowing that, the marketability of domestically manufactured products, that's gone up a great deal in the last several months. So anyway, Joel, Jared, would you like to add anything? Okay. Well, like I said, Joel handles the legislative side of things out of the Washington office, and Jared handles the constituent side of things out of the Grand Island office. And it looks like we do have one question from Michael Fagler. Michael? Is Michael unmuted? Jared, do you know?
Yes, he should be able to speak.
Okay. Michael, maybe stepped away. Well, we can come back as well, or Michael, I would encourage you to let us know what your question is, and we can certainly get you a response, either from me or from our panelists as well. But grateful to all of you for your participation here today. Again, thank you to our panelists from Kansas City, Lexington, and York, assuming everyone is calling in their posted locations. And we're all in this together, believe me. I mean, obviously the president himself has been no stranger to the virus. all of us in our communities across America, there's no one protected from this virus. And so that's why our cooperation and really focusing on technology and just innovating our way out of this and being creative about it. We know that necessity, as the saying goes, necessity is the mother of invention. So I think we could very easily see, some reforms to the vaccine research and that whole process. And I wouldn't wish for us to be in this scenario. Let me be very clear. I will also say I think we can be stronger for it. I think we can take some things from this instructively moving forward, finding out that some of our institutions and processes very durable and appropriate moving forward. Other areas, we could perhaps change and be more responsive and hopefully more than anything, I would hope that in Congress, we will recognize that communities and providers need the agility to exercise their best judgments every step of the way, rather than feel like the heavy hand of the federal government might be standing in the way. So Michelle, thank you for your reflection of really listening to providers themselves and what communities need. So with that, I again want to say thank you to our panelists and to all of our participants here today. If you have further questions or concerns and ideas, feel free to let me know, let my staff team know as well. Meanwhile, I'm just grateful for all of you and look forward to hopefully meeting in person one day soon. So with that, we'll wrap it up and wish you well. Take care. Stay healthy.
Thank you. You
Thanks
too.
so much.